As we travel further up the 95 corridor, it's just my great pleasure to warmly welcome back our next presenter to the stage, Vesper Moore, the Chief Operating Officer of Kiva Centers in Massachusetts. And I hope that you all had the opportunity to join us at our virtual conference almost a year ago in 2022, where Vesper spoke about the future of mental health, disability rights, and peer support. And if somehow you missed that, it is available on our YouTube channel. You can watch the video. But Vesper Moore is an Indigenous activist, trainer, writer, and psychiatric survivor, and they have been widely recognized for their advocacy in bringing the perspectives of MAD, labeled mentally ill, neurodivergent, disabled people, and psychiatric survivors to national and international spaces, whether as a lecturer for universities, a consultant for the US government or the United Nations, or being at the forefront of legislative reform to shift that social paradigm around mental health. But as Chief Operating Officer, Vesper has been really instrumental in the Kiva Center's growth and their operation of 2 peer respite centers that offer rest and reflection for folks experiencing emotional distress. So thank you so much, Vesper, for being with us again, and the floor is yours.
Thank you for having me, as always. And I think it's great being in this space with both Steve and Shireen. I admire the work that you all do so much. I think our organization does as well. Our peer respites are relatively new. We started in 2021, but we are fast growing and continuing. As you can see here, we kind of have an opening slide. This is just some of our community members gathering. In the corner, there's a drum circle, us being outside. We do a wide variety of things, which I will describe, but just before we get into peer respite. Next slide, please. So a little bit of history of the Kiva Centers. Our organization comes directly from the civil rights movement. We started as an activist group, a mental health activist group called Empower in 1987, directly from the Mental Patients Liberation Front. You can see some images of us rallying over the years for different causes, and as well as different founders rallying. In the corner, you see Judy Chamberlain, who was one of the founding members of Empower, along with Pat Deegan and several others. I think it's important to start here, really, because this is for us at the root of why we do this work, why we do peer support work, because we are an organization that's run by psychiatric survivors, trauma survivors, people in substance use recovery. With these variety of experiences, what the commonality there is that often society can view us as disposable, and that's a part of the larger issue, and that's rooted in a lot of different things. But that's led us to the creation and the implementation of so many lived experience peer run initiatives that we have come to grow and know over the years. I guess in description of the pictures, the very top, that is Empower folks protesting electroshock treatments when electroshock was prevalent. And then below, that is us advocating for peer support expansion in Massachusetts, and advocating for voluntary peer support, peer run services, because that is at the root of what we do and what we care about. Next slide, please. So the meaning of the word Kiva. The word Kiva is a word that represents the ancestral chambers of the Hopi people. This is a picture of a Kiva. I actually took this picture. I climbed into that Kiva and re-emerged. It was about 113 degrees outside. And you can go in, and it's a cool space where you can sometimes focus, meditate, go deep within yourself, and come out healing yourself. So Kiva, you can think of Kiva as a metaphor for self-determination, for autonomy, for personal journey, trauma healing, personal journey with healing. The turquoise K that you see in our logo, that is a representation of freedom, because it is a feather. And amongst a lot of indigenous tribes, the feather has always represented liberation. Next slide, please. So our mission. This is a photo of us gathering with a few of our friends in the Netherlands, actually in 2019, I want to say. And our overall mission is, as a peer-run organization, we work with folks with different social impacts, such as mental health conditions, substance use recovery, trauma. However a person may define their experience or what brings them to our doors really is up to that person. We're willing to meet them in a lot of ways. Kiva Centers, we operate a recovery learning community. We operate 2 peer-run respites. We do certified peer specialist training for the state of Massachusetts. We do peer bridging. We do quite a variety of things, which I'll delve into a little bit further after. Next slide. And here are the pieces. So we also do technical assistance. So we also have been supporting folks as they've been looking to start peer-run respites in different places like Indiana and Chicago. And we also do a lot of coalition work amongst peer workforces, because in Massachusetts, we have community health workers, we have peer recovery coaches, we have family partners, we have certified peer specialists, we have many different professions that maintain distinction for one reason or another. And it's very important that we emphasize the value in those differences of those roles, as well as the value of the similarities and how we can co-collaborate as communities. Next slide. Here's a fun fact about peer respites. Studies have shown that peer respites can reduce hospitalization by 57%. This is from some early studies in California. I am sure there have been far more studies since, and I'm looking forward to seeing some of the work that On Our Own Maryland is doing to really further research peer-run respites, because we need to show what we already know, which is this model works. It works for so many out there. And in terms of, kind of what we have discussed so far, which is the idea that by folks going to peer-run respites, they aren't interrupting their lives. There isn't a significant change. Sometimes during a hospitalization, someone's medication can be adjusted, someone's housing and or employment can be compromised. There are a variety of things that can happen. So by having a peer-run respite as an intervention in this way, we are really coming in and supporting people and maintaining that autonomy in their life and really fostering it. Next slide, please. So our peer respites. Our Karaya peer respite, the word Karaya is the Taino word for rest and reflection. It's symbolic of the moon. Actually, it's the word for the moon spirit. I'm a Taino person. Our executive director, Brenda Vizina, she's a Hopi person, which is why we have the concept of Kiva and why we have the Taino concept of Karaya. Karaya, specifically being in Worcester, Massachusetts, is more of we have more of a Hispanic, Puerto Rican, Dominican community. And a lot of Puerto Rican and Dominican people are of Taino ancestry. So for us, it was very important as a way of being culturally responsive to name the respite Karaya and to speak to that experience. Our Juniper peer respite is in Bellingham, Massachusetts. And Bellingham, the juniper berry, the juniper tree, the juniper bushes specifically can be found and are native to those lands. The juniper berry is has been known to have healing factors, and the juniper tree itself is very resilient and strong. So you can see again these metaphors rising. But overall, our peer-run respites are crisis alternatives to the traditional system that you know. We are 100% peer run, from our board of directors to our executive team to our management team to everyone in the community that helps sustain Kiva Centers. Next slide. Here are some pictures of our Karaya peer respite. So you can see the walls are colorful. It is a home environment in the more, I would say, rural area of Worcester, just outside of the hustle and bustle of the city center. But at the same time, it's so close to all of the resources and and all of the creative things that Worcester has to offer, like the Worcester Art Museum, fantastic brunch places, many different things that people can immerse themselves in. Because I think something that's important is that although people stay with us for 5 to 7 days, sometimes more if they request an extension, we like to do things together as a community. So usually on Saturdays or Sundays, we could go bowling, or we go to the Worcester Public Market and we have boba tea, or we're sharing a meal, or we're doing a lot of these things together, because we do actually believe that it is in collectivity, it is in community that we find healing. And as you can see, every room that we have at our Peer Respite, they are private rooms. They all have small refrigerators if a person needs refrigerated medication, or if they need to refrigerate something in their space. Everyone can access their own space, come and go as they would like. People manage their own medication at our respites. And it's important to mention that, like, when a person is unhoused and they're coming to our respite and they're staying with us for a period of time, they can stay a maximum of 30 days. That's what the state will allow us to do. And we have done that on a few occasions. One such example I can think of was we had a guest who was trying to get into a sober shelter, but couldn't get into a sober shelter unless if they stayed in what's often referred to as a wet shelter for a period of time. And the challenge with that was that it was going to impact their sobriety. So instead of staying in that shelter, we were able to work with people on their team, and they were able to stay at our respite and then go to a sober shelter. That's a good example of a sustainability model, because had they gone to the other shelter, it would have compromised their sobriety, and they wouldn't have been able to go to a sober shelter, and they would have likely stayed unhoused longer. Luckily, this person has been housed for 2 years now. So it's exciting stuff. Next slide, please. As you can see, more pictures. We have a garden both in the front of our Peer Respite, and in the back, we're trying to build garden beds. We do believe in like peer support and agriculture and like working together, and like sometimes you're having your hands in the dirt and really working together in that way can be healing as well. And then this is one of our community spaces, generally where we have peer support groups, or if people just want to have a conversation, share a lunch, or take a snack to the other room. In this space, people can kind of utilize it in the way they would like. I think it's so important to mention that often when people are in inpatient environments or other environments, they do not have the same autonomy of space. So we do believe that it's so important to be able to know that, like, this is your community space. Yes, you are a guest here for this period of time, but we are sharing and working together in this space as much as possible and as much as you would like. Next slide, please. More pictures of our Peer on Respite. This is our kitchen area, as well as our living room area. Next slide. So here are some things that our guests say about our Peer on Respite. This is one review. The caring and compassion I received here, both this time and the last time I was here, was more healing than every other program I've been. And I think, something that allows that to be attained is really, one, having people who understand to some degree the experience that the person is going through because they've been through something similar. And then I think it also has to do with the environment. Environment matters. Something that we train our peer respite advocates and we train certified peer specialists in, and that we train peer support workers in a lot of contexts, is the idea that the presence of positive messages does not matter as much as the absence of negative messages. And what that means is that if someone's saying like, oh, this space is all yours, feel at home here, feel welcome, it can be eliminated or really not have as much of an impact if there's another sign that says you are a flight risk, stay in the other room, you are not allowed to leave this area, you are not allowed in this area. So So we teach that idea, the idea that environment matters, and that there needs to be an absence of negative messages as well as the presence of positive messages. Next slide. Here are some photos of our Juniper Peer Respite, which has been open for, I want to say, a month and a half now. This is our Karaya Peer Respite that you had seen before is a 6-room peer respite home with 3 bathrooms. We also do offer mobile peer respite to folks across the state of Massachusetts. That mobile support is usually up to 4 hours at a time maximum, but can be as little as 30 minutes or whatever the person requests. We do that both virtually and in person. And usually what that support is comprised of is that we meet a person in the community at a location of their choosing that is mutually agreed upon. And then from there, we really get to listen and then kind of figure out, how can we support you? How can we work together? And where do you need support when you are going through an intense instance of crisis? So our Juniper Peer Respite is in the Bellingham community, which is much more rural than Worcester. And I think one of the great things about the Juniper Peer Respite is that this is the only mental health resource in that town. The closer resources to Bellingham are usually in Dedham, or they're in Boston. They're usually an hour, 30 minutes, 40 minutes out. So this respite has been really crucial for the community that has been so isolated and so far from various resources in Massachusetts. Next slide, please. You can see we have our dining room table, other rooms. And as you see on the bed, we have these welcome baskets that usually have clean towels, snacks, variety of snacks, shampoo, conditioner, things that people are looking for. And again, we have a refrigerator in each room, small refrigerators on the nightstand. Next slide. And then here are some more things that our guests have to say about our peer respites. In one survey, we had asked, how is the quality of the support you received to all of our guests? And they reported that 94% of them reported that they received a great quality of support. And then 6% were undecided. And I think, often when folks do join us, they can be coming out of an intensive inpatient environment, crisis stabilization environment, clinical respite, another space, or sometimes directly off the street. So if they are in a space of trauma, it can be hard to interpret the type of support you received, or oh, wow, this is a nice environment. This is the first time I've experienced this in this way. Next slide. Another quote from one of our guests: the peer respite advocates, first and foremost, there aren't enough words to describe these people. They are lifesavers. I also love the welcoming environment, the cleanliness, and the groups. So this was in response to, what did you enjoy most about your stay with us? And this person had reflected that it was really the relationships with the people who worked there. I think a key to that is that we maintain transparent and mutual relationships. I like to say transparent first, because when someone's in a working role, even though the goal in peer support is for the relationship to be as mutual as possible, there is still a level of separation and difference because you are in a working role. So often we are transparent about that, and then we work to be as mutual and as reciprocal in that relationship as possible. Next slide. And then again, a similar percentage, which I found interesting, we had asked our guests if they felt safe when they stayed at our peer respite, and 94% felt safe and 6% felt undecided. Next slide. I see a question in the chat, and just to briefly answer, our peer support groups, we do open topic peer support groups, we do living with suicide peer support groups, we do hearing voices peer support groups, we do trauma-centered peer support groups, we do grief and loss peer support groups, we do intergenerational trauma peer support groups, we do art groups, we do music groups, a wide variety of things. Generally in our respites, we have djembe drums, and we have bongo drums, and we have guitars, and we have a variety of art supplies, and then we have trained facilitators who come into the space and facilitate some of these support groups. So another thing that one of our guests had to say about our peer respites is it's very welcoming here, and it's not like an oppressive, uncomfortable setting. I feel genuinely supported and cared for here. I feel like all the mental health that all mental health treatment should be like this, because it's the only thing that makes sense. A safe and relatable community is what I've always needed. In the past, I got the opposite, disguised as mental health care. So this was like a breath of fresh air. I hope to bring the sense of safety I've gathered here with me in the future. This place is a gift. So as you can see, this person's reflecting on prior experiences. I will say most of the folks who are recommended to be at our peer respites are usually Department of Mental Health involved, Department of Corrections involved, unhoused. A lot of folks have been in inpatient care settings for a long time. A lot of folks have been in inpatient care settings for a short time. So it's really a wide variety of people who have different experiences. But I think regardless of what their background and their experiences, we treat each guest the same way, with the full intention of this is a community space. You can express what you need. We have so much to offer, but also take time to rest, take time to take care of yourself, and together we are working as a community to reflect, to build, to find what we are looking for ourselves.